Take a little trip with me, I'm gonna take you home.
Take a little history
Take a little
down this lane of memories.
down this lane.
So let's raise another glass for the glorious past and the friends we have become. Yeah, yeah, 'cause little did we know the good times come and go, but the best is yet to come.
Hello and welcome to a special interview for The Wire. What is the true picture of the spread of COVID-19 in India and how effectively is India coping? Those are the two key questions I should put today to the director of the All India Institute of Medical Sciences, Randeep Guleria. Dr. Guleria, as of 9 o'clock this morning, Saturday the 23rd, the website of the Ministry of Health says that India has just over 125,000 cases, which is marginally more than 50% of China. Secondly, the daily average of cases and deaths calculated on a weekly basis has been growing week by week. It's grown every single week for the last 8 weeks. Does that suggest that the fight against the virus is getting tougher?
So there are two things. One is if we look at the rate of growth is much slower than what it has been in many countries abroad. And therefore, I do feel that the lockdown has helped us in two ways. One is that it has given us time to prepare for our facilities, whether it be the hospital facilities, whether it be training of the doctors, whether it be the equipment that we need for number of cases that, and we've been able to do that over the last 4 to 6 weeks. The second important thing is that although the numbers have continued to increase, the curve is not as steep as one was worried about, and because of that, it's actually made it easier for healthcare facilities to be able to cope up with the number of cases that we're getting. If I may add one final thing, that although the number of cases has gone up, the number of people who are getting very sick and requiring ICU care is still not that large. So we have a larger number of people who are mild or asymptomatic, and that is a positive thing as far as our country is concerned.
You've mentioned many things there, Dr. Guleria. Let me take them up one by one. I'll begin with what you said about the curve. You said it's not as steep as we had feared. But the truth is, when the lockdown was first declared, the intention was to flatten the curve, and that definitely hasn't happened. In fact, a 40-day nationwide lockdown in countries like China and Italy did see a clear declining trend. In India, the trend is not declining, it's still rising.
That's true. So there are two or three factors that we need to keep in mind, and that I think the most important factor that we need to keep in mind is, which I say is something that we have not been able to do successfully, is the citizen responsibility. And that is factors or comes from the fact that social distancing, self-quarantine has not been as aggressive as it should be. We've had this whole incident that we've had of one religious group, more than 2,000 people staying together and almost all being infected and traveling to different parts of the countries. We've had this whole unfortunate incident of migrant laborers traveling and thereby a possibility of carrying infection. But keeping all of that in mind, it's still important to see that our cases are limited to a few cities, the so-called hotspots. 80% of our cases come from only about 5 hotspots. And if we are able to aggressively work on these areas, and I mean in terms of really focusing all our let's say resources in these areas, and we make sure that there is no leakage of infection from these areas to other parts of our country, we would be able to start a downward trend. But I do agree with you that unlike the success that a lot of countries had, especially China, in terms of the lockdown, our success has not been as effective as it was there. But a lot of gains have happened because of the lockdown, and I think we have been able to manage to do a lot during this time.
A quick word on the lockdown. Are you disappointed that our success has not been as effective as China's?
So we are a democracy, and therefore we have to keep in mind that a lot of things in our country are not as, let's say, strict as happened in China. China was literally able to lock people in their houses and do a lot of aggressive things, which one would feel are not as part of what civil society does. And therefore, I go back to what I said, that for any pandemic to be controlled of this nature, there has to be an involvement of society in terms of controlling it. What really will work is if each individual realizes his or her responsibility in breaking the chain of transmission.
Nandi,
Somehow,
sorry, carry.
we have not been able to do that as successfully as I hoped we would.
The government insists that India hasn't entered the community transmission stage, but with over 125,000 cases, many people find that hard to believe. In fact, top epidemiologists like T. Jacob John insist that we've entered the community transmission stage as far back as the 18th of March. What's your belief? Are we in community transmission, and is it less than wise to keep denying it?
So my interpretation is that it's basically an issue of semantics. If you look at the whole country, there is definitely large areas of our country where there is no community transmission, and we're pleased with that because there are various parts of the country where the number of cases are very few, they're declining, and there is a positive trend. But if you look at the hotspots, that is those areas where the cases are really becoming huge, and these are especially the metropolitan or the larger cities, there is definitely indication that some degree of local transmission is occurring there, and that's why the number of cases are increasing significantly. So if we would say that is there community transmission at a national level? Possibly not. Is there community transmission occurring in these hotspots? That possibly is happening. And therefore, it's important for us to be able to differentiate the two. If we are talking about hotspots, it is likely. But if we look at the map of the entire country and then start saying that across the country is this happening, it seems less likely.
Now, in an interview that you gave Mint on the 7th of May, you said that India would reach peak cases in June or July. Doesn't that mean that for the next 6 weeks, the situation is going to get progressively worse before it starts getting better?
So what I had said at that point in time was based on mathematical modeling, and mathematical modeling is like a rough guess. And if you remember the initial mathematical modeling, which was done way back in April, it had predicted that we may have a peak somewhere during the mid of May. The current mathematical modeling actually had predicted that it may happen in June or July, and that is what I had suggested. I also am aware of another group which has done mathematical modeling and suggests the peak may occur even later on. So it's just based on what data you put in and how the variables are factored in. Also, it depends on the other factors which are not really sort of looked at when the mathematical modeling is done. For example, the extension of the lockdown and now the lifting of the lockdown or the movement of individuals which have started. So all of these are variables which cannot be factored in. And thereby, I personally feel that it's like making a rough guess, but you may or may not be right. And your guess may change as things evolve on a weekly or fortnightly basis.
Can I give you two reasons why people think that, in fact, the peak may move beyond June, July? Firstly, there are newspaper reports that suggest that the positivity rate of migrant workers returning to Bihar from Delhi, from Maharashtra, as well as from Haryana, is either double or triple the national average. And that, I presume, must be true also of migrant workers returning to UP, Bengal, Orissa. So as more and more migrant workers return, and they will be returning in their tens of millions, surely there is great potential for the spread of the virus to enhance and therefore for the peak to get pushed back into August and September.
So I think here there's another important thing that we need to keep in mind, and this is something that we've seen across the globe. That is, when we talk of peak, it's a peak of a region rather than of the country. If you look at what is happening in the United States, New York has peaked and the cases have started coming down. But there are other parts of the United States which are still having an increasing number of cases. So I feel that this pandemic will evolve over time in different parts of the country, and we will see different areas peaking, and how big the peak is, I'm not sure. But this will happen over a period of time. And that's why some people feel that for a long time we will have to live with COVID 19, as it will sort of move from one region to the other to some extent.
But then, if the peak should be viewed regionally rather than as a national peak, and if, as you say, the disease will evolve in different parts of the country, that suggests that in the states where migrant labor are now going, Bengal, Orissa, Bihar, UP, we will see much higher peaks in the weeks to come, particularly as more and more migrant labor go back to their villages.
So again, it comes back to the same issue that yes, that is possible. And therefore, we need to have good action that we can take at a regional level. And whether it's looking at contact tracing, whether it's testing for these individuals there, isolating them or quarantining them. And this is something that each state will have to develop a policy of how to do that. If they can do that, and if they're able to prevent a large spread or development of a cluster in that state or in that rural part of India where the migrant laborers have gone, the peak may not be that much and it may be more manageable. So, like I said, if we are having a strategy, that strategy has to be region specific, it has to be city and rural area specific, and it has to be based on a lot of citizen participation.
So far, we've been talking about the possibility of new worrying peaks in rural India. But what about new worrying peaks in urban India? Since Monday the 18th, the lockdown has been substantially relaxed. Markets are open, trains are running, and from Monday, planes will be flying. Isn't there a danger that even in urban area, even in those cities that you call hotspots, there will be fresh increases in infections, which will in turn push back the peak even in hotspots?
So that challenge is always going to be there, and that is why I feel that for India as a country, we need to balance the crises that may come with the other challenges that we have, whether it's related to economy, whether it's related to the laborers who are wageless and need support. How do we balance that out? And I think that is what the government is trying to do. From my point of view, yes, there is a concern as a physician or as a doctor that this movement may lead to increasing number of cases or some degree of surge, unless individuals realize their responsibility and stay at home if they have flu-like illness, maintain social distancing, use a mask whenever they travel, and even in offices there is some degree of social distancing maintained. If we do that, and we'll have to do that not only now, for very many months to come, we would be able to prevent a huge surge in number of cases, and that would be manageable as far as the country is concerned.
I'm intrigued by your definition and description of mathematical modeling. A little while ago, you said it is a rough guess. And most people would say, in fact, a mathematical model depends entirely on the assumptions you put into it. Now,
Correct.
yesterday, the government revealed, quoting several different mathematical models, that something between 37,000 and 78,000 deaths had been averted, and something between 14 and 29 lakh cases had been averted. And in both cases, you see the spread is enormous. It's 100% in each case. Are these just rough guesses?
So mathematical modeling depends, like I said, on the factors that you put in. And it depends on the group which has done the modeling and how they put, what is the weightage they give to each factor. That's why I said that it's a tricky business and a difficult business. And this modeling is something that is done more by the mathematicians, but sometimes the ground reality may be different. And that's why predicting the peak is a dangerous thing to do, because not only here, I'm sure whether you look at data from the US or from Europe, a lot of predictions were totally wrong as far as the peaks were concerned.
Can I then ask you a slightly awkward question? As you say, a lot of the times the ground reality could be different. How much credibility do you give to these mathematical models announced yesterday about the number of deaths prevented, about the number of cases averted?
So I'm not sure what mathematical modeling was done. It's difficult for one to predict, because it's based on a lot of assumptions. Whether those assumptions are true or not is difficult to say because we haven't gone down that path. But I do agree with one factor, that if we did not have a lockdown, and if we did not have that strict restriction to in movement, which happened very early, whether it's international travel, whether it was national travel, stopping the railways, and especially say the metro or the suburban trains in Mumbai, there would have been a huge surge of cases. So we have been able to delay it to some extent. We've been able to keep that numbers down to some extent. In my mind, the challenge is how long can we sustain it, keeping in mind the economy and the hardships that the lower socioeconomic status people are facing. And if we have to balance that out, how do we do that without a huge surge in cases which would not be or will be difficult to manage as far as the health sector is concerned?
Dr. Guleria, at this point, let's come to some statistics. I hesitate to call them facts that the government at least takes great assurance from. To begin with, at all the press briefings that are held, we are told about the recovery rate. As of this morning, it is 41.4%, and that gives the government great comfort. But Italy, with 32,486 deaths, has a recovery rate of 60%. Spain, with 27,940 deaths, has a recovery rate of 70%. So it's quite clear that you can have a very high recovery rate, but at the same time, you can have a very deeply disturbing death rate. The two do not preclude each other. So how much comfort can we in India take from a 41% recovery rate?
So first of all, I think recovery rate will vary as the pandemic progresses, because obviously we have a large number of people who are recovering are in hospital. Most of them are mild or have very few symptoms, and therefore this recovery rate will pick up and probably become more than 60 to 70%. If we look at the number of people who are actually in the ICU on the ventilator globally in our country, it's less than 100 people. So that means the remaining part of and the number on oxygen is also very few. So if we look at it from that point of view, that means all the others who are admitted are having very mild illness, and there is a very strong chance that they will recover and become all right, and therefore the recovery rate over a period of time will tend to improve dramatically. Also, we should remember that the guidelines keep changing. So there was initially the strategy that we admit all COVID positive patients who, even if they are having no symptoms or are mildly symptomatic, and therefore your admission rate would be higher, and therefore it would depend upon that as your initial criteria. Now we are saying that all those who have mild symptoms or those who are asymptomatic can isolate themselves at home, and that is also being allowed. So therefore, if you start looking at the data, it has to be looked at properly in terms of what is the change that has happened in the interpretation over a period of time.
Now, you mentioned in that answer the number of people on ventilators, and that brings me to a second set of statistics that, for a lot of laymen, give comfort and reassurance. To begin with, our mortality rate in India is 0.2 per 100,000 compared to a global average of 4.2. Our infectivity rate is 7.9 per 100,000 compared to a global average of 62. And finally, only roughly 6.4% of our cases go to hospital, and as you said a moment ago, under 0.5% are on ventilator compared to a global average of around 3%. Now, does this altogether suggest that the virus is less virulent in India, or does it suggest that we, for some reason we don't understand, in India have better immunity?
So that's true. So there is a lot of interest in the medical community to see why is it that we are not getting that severe illness as was seen in Italy. And the theories are that we are a younger population. The mortality is much lower in the younger population as compared to the older population. Second is that all of us have got a BCG vaccination, and it's been shown in some lab data that the immunity that the BCG vaccine gives has also some antiviral action, and it may be useful in protecting people from viral infections. And then there is another theory that the virus may have mutated, and the strain that is circulating in India may be less virulent, and therefore the mortality may be low. I don't think we have a definite answer as to why the mortality is low. But it's a fact that the number of people who are actually requiring the ICU care or oxygen support is less than what we had thought of about 4 to 6 weeks ago in terms of what the numbers could be.
In
And,
an
and,
interview
and,
that he,
and therefore, if I may just go back, that's why mathematical modeling can be wrong.
absolutely. In an interview that he gave the Economic Times this morning, Health Minister Harshvardhan has said, and I'm quoting him, he's talking about the virus. He says, it is not that virulent in India. Is that just his hunch? Is that based upon the sort of studies that are incomplete that you referred to? Or do we have good scientific reason for saying it's not that virulent? Which of the three is it?
So currently, like I have just referred to, that the data suggests that it's probably not virulent, but we need to be able to confirm that data. And I think it's early days before we are able to say one way or the other. We're still going through the pandemic. How it will evolve over the next few weeks or months will actually be able to strengthen our belief much more as this pandemic evolves in our country. But whatever data we have currently as compared to the morbidity and mortality does suggest that we are behaving differently from what was seen in the Western world. But this type of low mortality has also been reported in some countries in Southeast Asia also.
There are some other reports in newspapers, not statistical, but other reports that sort of bear out what you're talking about. And I want to ask you how much credibility you attach to them. There are reports, for instance, that there hasn't been an increase of patients coming to hospital with respiratory symptoms and illnesses or with influenza-like symptoms. Separately, there are reports that purchase of medicines to take care of such conditions hasn't increased either. Now, you run the most important, the best known hospital in the country. Are such reports credible and accurate? And if they are, do they corroborate what we've been talking about?
So first of all, if you look at COVID-19, the bulk of patients who present with influenza-like illness and lower respiratory tract infection. But as the pandemic has evolved, we have started learning more and more about the virus. And this is not only in India, but as a global phenomenon. And we've realized that this virus, unlike the flu virus, is not a virus which causes only a simple pneumonia. It causes systemic manifestation. It causes swelling of the vessels, what we call endothelitis. It causes a higher chance of clot formation. And therefore, we are having patients who've come to us and we didn't suspect them to have COVID-19 initially with stroke. So stroke occurring in a young individual has been found by us to be able to, which is COVID-19 positive. We found individuals with myocardial infarction, a heart attack, who had this because of COVID, who are COVID-19 positive. Some may argue that this is just a coincidental thing, but I think there is enough pathophysiological data which suggests that this virus also causes systemic effects which can lead to other organ involvement. And that is why a high index of suspicion is needed in by physicians when you have an atypical presentation that this could be COVID-19. And this makes the task of clinicians more difficult as far as screening and exposure is concerned.
You're saying something very interesting. I'm putting it in layman's language. Just because there isn't a recognized increase in respiratory or influenza-like symptoms, or just because medicines for these have not increased in sale, that doesn't mean to say that we can take much comfort, because we've had strokes in young people, heart attacks in young people, inflammation of the sort you're describing, which we didn't expect, and we now realize that these are also COVID-related problems.
Correct, but the bulk of symptoms continue to be respiratory, whether it's a sore throat, cough, cold, body aches. But even if you look at the international criteria, they keep changing because they keep adding some new symptoms: body aches, asthenia, loss of taste, loss of the sense of smell. Because as we are, or diarrhea for that matter, as we are now seeing the pandemic evolve, we are realizing that it can involve other organs also. And therefore, we need to have a high index of suspicion when these manifestations also happen.
Now, a lot of our comfort and assurance comes from the fact that India has a particularly low mortality rate. But there are people who question how accurately we are reporting mortality. For instance, you will have seen reports in newspapers that municipal corporations in Delhi have officially recorded twice as many COVID related burials and cremations compared to the number of COVID related deaths that the Delhi government has recorded. And I'm sure similar mismatches have happened in several other towns and cities. And when it comes to rural India, I'm not sure if we have an accurate, leave aside, reliable way of recording whether a death is COVID related or otherwise. So, how accurate is this mortality rate from which we take a lot of comfort?
So there are two things. One issue is that there is definitely a need to look at this data, and we're trying to do that in terms of what we call a verbal autopsy, that you can look at all the deaths and try and talk to the collect more data, because autopsy is not done to see whether this could be related to COVID or it may not be related to COVID. Secondly, looking at the data from the Registrar General Office of India in terms of overall deaths, one gets an idea, is there an increase in respiratory related deaths, or which are sort of not labeled as COVID but could be related to COVID. And whatever data that I've been able to sort of ask people about does not suggest that there has been a lot of big spike in these deaths, even in those who were not diagnosed to be COVID, as compared to those who were definitely COVID positive. So I think there is a little bit of reassurance that it's not that we are missing out on the mortality because of lack of reporting, and there are a large number of hospitals which would even do a sample for COVID, even if the person is brought dead to the hospital with an acute with some acute event which happened at home.
Dr. Guleria, let's take a break at that point. In a much shorter part two, when I come back, I want to talk to you about what you believe are the essential steps the government must now take here onward. But first, a message from our sponsor, Glenlivet.
Take a little trip with me, I'm gonna take you home.
Take a little history
Take a little
down this lane of memories.
down this lane.
So let's raise another glass for the glorious past and the friends we have become. Yeah, yeah, 'cause little did we know the good times come and go, but the best is yet to come.
Welcome back to a special interview for The Wire. My guest is the director of the All India Institute of Medical Sciences, Randeep Guleria. Dr. Guleria, in this part two, let's talk briefly about the measures you believe the government must take here onwards. To begin with, everyone says we need to ramp up testing. As of 9 a.m. today, Saturday the 23rd, the Ministry of Health website says that we've done a total of 2.8 million tests, and we're averaging just over 115,000 a day. I know in absolute terms that sounds like a lot, but it's only 1973 per million compared to 65,000 per million in Spain and 54,000 per million in Italy. So will you agree ramping up testing is an important priority?
Yes, ramping up testing is an important priority. And I think if you look at the number of tests we were doing 4 weeks ago, it was only 10 to 20,000 tests a day. We have now crossed 100,000 tests a day, and we are actually hoping to double that in the next few days or weeks. And hopefully we will be able to do many more tests. The challenge is that we are a huge country. Our population is really very, very huge. And if we were to say that we want to test, let's say 5% of the population, that would mean doing 7 crore tests. That was something which is literally impossible, even if we were to get all the kits available in the globe to do that testing. And then a single point test will not give you the information that you need. This is a virus which evolves. So you will need to see how do you test individuals at different points in time. So my feeling is that the testing strategy has to be done to answer a question that you have. If you want to see that what are the admissions happening in hospital with severe acute respiratory illness and how many of them are COVID related, then it's worthwhile to do testing for all SARI cases, the severe acute respiratory illnesses. If you want to see in rural India, are there anyone who has flu-like illness, and could that be COVID ILI, or could it be a non-COVID ILI? So depending on what we want to test and what answers we want, which will change our policy decision, it's worthwhile to test. Just to do testing as a random part or just to test everyone probably will not be useful. As a matter of fact, this is the biggest issue that is coming up as offices and say other businesses open up. How do they test? Should they test everyone at the point of entry? We know that you may be in the pre-symptomatic phase, or you may be in the early stage and your test is negative. You can't keep testing everyone every week. It doesn't make sense. So you will have to go by a symptom based strategy, and also doing two things: either testing those who have symptoms or who have come in close contact, or by looking at strategies which over a period of time I think we will be able to do aggressively. Look at the antibodies which have formed, and those who have antibodies, you can reassure them that you have had the mild infection, you're all right, and you don't need to keep testing them.
You're talking about a targeted or strategic form of testing where you either test people with symptoms or people who come in contact with others who have symptoms. Because as you pointed out, we can't even hope to test something like 5% of the population, that's 7 crore, and it's beyond us. On the other hand, if you don't do some element of random testing, how will you discover what percentage are asymptomatic carriers? And surely that is a concern that we need to have some element of idea of how large is this quantity, and do we not need some form of random testing to discover that?
Yes, you do. I agree that you need to do some sort of testing to see what is the, let's say, percentage who have had the infection and have recovered. But doing the RT-PCR testing, the testing by the nasal swab, is not going to be effective because that will not tell you the answer. It's a one-point test. My own feeling is, to answer that question, we will need to do a surveillance study which will look at the antibodies. That is a more robust way of saying that you have had the infection and you have now recovered, and now there are antibodies in your blood. And this is a simple test to do, and this can be done at a large scale. And I think that is already started as part of the surveillance study being done by the ICMR in various states. But that would give us some idea in terms of how many people have had the infection. It's not a diagnostic test. The nasal swab or the RT-PCR is the diagnostic test that we need to do. To answer the question of how many have had the infection and have recovered, we need to do the antibody test, because that will give us more information in terms of who have recovered and now have the antibodies.
And
By
the
doing
antibody test can be done on a more random selection basis. To
correct,
be
and it can be done to a larger number of population, and though the ability to do that is available both in terms of kits and in terms of what we call ELISA based tests, which are easier to do.
one question about people who are anti or asymptomatic but are believed to be carriers of the virus, how much a concern are they? Initially, it was thought that they could infect others quite easily. Now there seems to be questions and doubts about that. What's your view? How much of a concern are these people?
So there is a cause of concern, but the point that you're making is very true, that the chances of them being as infectious as a person who is symptomatic is to some extent less. Remember, the infection spreads through droplets, and if you are not coughing, sneezing, then the let's say the density of this infection that you can spread has come down. It's only by talking that you are then causing the virus to come out, and the distance that it can come out is much less. So your chance of being infectious is lower than a person who is coughing and is sneezing and has significant symptoms. So I think that is the variation that happens. But having said that, the asymptomatic do have a potential to some extent of spreading the infection. So we need to really still continue to wear masks, regularly wash our hands, and maintain the physical distancing that we keep talking of.
Dr. Guleria, the last issue I want to raise with you is the need for timely and transparent information as the number of cases grows, as the peak perhaps slips beyond June, July to August, September. There will be a sense of anxiety, apprehension, even fear that will grow in the people. And clearly, the idea behind press briefings is to contain it and to reassure people. And that's only done with transparent information. Now, in the West, these briefings are regularly held every day, and a senior minister fronts them. In India, they're held by bureaucrats, And over the last 2 weeks, they seem to have become irregular, if not infrequent. If we're going to seriously contain anxiety and apprehension, would you accept we need better briefings?
So I think the issue here is, I do agree with you that as this pandemic progresses, there is definitely a need to be able to be transparent for very many reasons. One reason is to be able to see how we are doing and what are the ways that we can become better, how we can help get citizen support, get supports from NGOs, from other groups, so as to help us contain the spread of the infection and also support the population, especially the marginalized population, in terms of looking at their needs. And I think also the important issue is to learn from different areas. There are some states which have done better than others. What did they do better as compared to others? So the transparency would help to understand how have states managed their cases and managed to control the spread as compared to others, and how can one learn from each other. So I do agree that there has to be a transparent mechanism which has to be put in place, which is basically reassuring for individuals and is also a learning for everyone, because this is a learning for all of us. For us as clinicians, like I said, atypical manifestations we did not expect earlier. Now we are looking for it, and we're finding more and more people positive, and we're transparent about it. We, as doctors, need to also see what are the new treatment strategies that we can use, and has something worked somewhere, and can we try it in our setup. So as we learn more about this virus, as we learn more about how things are evolving, we should be transparent enough so that we can actually, at the end of the day, save lives.
My last question, and it's to do with the sort of information that is made available to the Indian people at briefings. On the 20th of May, that's just 3 days ago, Lav Agarwal compared India to the 15 worst hit countries on the grounds that their collective population was roughly the same as India's. He then pointed out that they have 34 times more cases and 83 times more deaths. And this led him to the conclusion that this says a lot about measures taken by us to manage the situation. Now, when I put this to India's top epidemiologists, they began to laugh. For instance, Professor Jayaprakash Mudiyal said this is a meaningless comparison. Professor T. Jacob John said it's an unintelligent one. One of them said to me, why compare India to the 15 worst hit just because their population is the same as ours? Why not compare India to the 30 least hit who probably also have collectively the same population as us? If you do the latter, India will look worse, but if you do the former, India will look better. What do you make of this sort of information being provided?
So I think the issue here are two. One is, like you said, if we need what are the positives that we can give to the population to reassure them. So maybe this is something that is positive that one can give as far as reassurance is concerned. But I also feel that each country behaves differently. Each country works in a different mechanism, and thereby their own strategy there is something that we need to look at. Our own strategy is to save our own citizens' life, to see that how our infrastructure and health facilities can be optimum so that we can manage any surge of cases, and how we can solve our own problems. Each country has its own problems. India has its own unique problems which are not going to be there in Europe, or not going to be there, let's say, in the US. They're not going to have the type of migrant labors that we're seeing. They're not going to have the type of urban slums that we have. And sometimes I feel that maybe we, as a government, and we as people who are involved in the health sector, are more involved in looking after our patients than what sometimes is being seen in terms of other countries. So therefore, it is important for us to look at how we can improve rather than saying we did better or worse than country A or B.
That's a very clear, diplomatically put answer. Each
Okay.
country behaves differently. You said each country has its own problems. It's more important to look at how we're handling our problems rather than to say we're doing better than A or B. I think in that very diplomatic way, you've more than answered me. My last question, at the end of this interview, there will be a thought in the minds of the audience. Are we winning the fight? Is it too early to say so? Does it look as if there's still a big struggle ahead? Which of the three?
So I would say that till today we have been all right. We've been able to manage to keep the numbers reasonable, but the fight is still on because, as you rightly pointed out, the scenario is changing. People are traveling. There is a lot of movement which has occurred. The virus thrives on this because as people move, the infection also travels, and this has happened not only at a national level; it's happened at a global level. The movement of the virus from China to all over the world was because people moved. So therefore, the issue of being aggressive in terms of testing, isolation, all the measures that we mentioned in terms of social distancing, hand washing, masks become equally important. And therefore, the next few weeks or months are going to be the most challenging that our country is going to face because we have to now work on not letting the cases increase, keep this curve flatten. I'm not that much concerned if it still continues to rise at the pace it is because the doubling rate is still not that rapid. The concern is if we have a huge spike and then we have a huge number of cases. To some extent, as of now, it's manageable, but the future is something that one would not like to predict, even if we do some mathematical modeling.
So, as you said, the next few months will be the most challenging the country has ever faced. In other words, victory may possibly be on the horizon, but it's too early to claim we've got it.
Correct.
Dr. Guleria, thank you very much for the time you have spared and for explaining things so fully. Take care, stay safe, good luck.
Thank you very much. Thank you.
To receive instant updates on all videos from The Wire, click the subscribe button and hit the bell icon. Pay to support independent journalism. Click the link in the description and choose the amount you want to pay.